Here are the 5 most important healthcare topics for you to pay attention to in 2024. Number 1, direct primary care, otherwise known as DPC. DPC takes a traditional primary care service model, which is fee for service, where every time a service is rendered, there's a charge submitted to the insurance company. It takes that financial model and turns primary care into a fixed cost or a monthly membership fee. So the employer usually covers the cost of that membership for the employee, and in turn, you get a more predictable cost for primary care. You get a better doctor-patient relationship. Typically, the patient has more time with the doctor than they usually get today. They also often get 24-hour access through text as well as virtual appointments, and it just improves the overall quality of care that is delivered, not to mention the physician has an improved quality of life as well, which is something that doesn't often get talked about. So DPC is number 1. Number 2, Gag Clauses and the Gag Clause Attestation. As of December 31st, 2023, employers must attest that they do not have gag clauses in their health plan contracts, their TPA contracts, etc., etc. This is part of the Consolidated Appropriations Act, otherwise known as the CAA. I'll admit, I am not an expert in this field. I've talked to a lot of people who are. It delves deep into the world of regulation and compliance. I would definitely get with somebody in your compliance department if you are a consultant and learn more about this. I suspect this will be one of the most talked about things in 2024. Shout out to Mark Combs for really putting this on my radar. A lot of very smart people are talking about this. We're probably going to see fines. We might see some folks made an example of, and ultimately the onus is now on the employer to make this attestation that there are no gag clauses in their contracts. And so the pressure is being put on them, and now they're going to have to seek out other vendors or seek out relationships with insurance carriers and TPAs, etc., that offer more transparency and access to the data. So I think the long-term impact will be very positive, but the short-term impact probably is going to be some pain. Number 3, non-network solutions. So there's really 3 big non-network solutions that I talk about quite frequently. It's reference-based pricing, direct contracts, and bundled surgical procedures. So reference-based pricing, a lot of you probably are familiar with it. That's using Medicare as a reference point or a barometer, adding some spread on top of that, and then negotiating with providers and hospital systems for a negotiated rate that's a function of Medicare. Typically what that means is there'll be significant savings on average versus their PPO contracts, but could create a little bit more disruption and noise, and so it has to be managed a little more actively. Now, direct contracts. Rather than using an intermediary like a reference-based pricing vendor, you would just simply be an employer with your consultant, go directly to those hospital systems or maybe directly to a hospital itself and say, hey, I will bring my people to you. I'm an employer. I will bring my people to you, but I want preferred rates or I want really advantageous pricing. So you directly contract with those providers. And then number 3 is bundled surgery procedures. This is something like what Dr. Keith Smith does in Oklahoma City, where you could go get, say, a knee replacement. And rather than having to submit that insurance, wait for it to get negotiated, bought down, and then ultimately paid, you would just go and pay Dr. Smith directly. The employer typically is the payer. They pay Dr. Smith directly. There will be a predetermined rate for all of the components of that surgery, including facility, his or her charge, the doctor, anesthesiology, any follow-up. It all gets bundled together, so that's where the name comes from, and it is one flat rate. So non-network solutions, the 3 of them, I would get educated about those in 2024. Number 4, you wouldn't expect me to have a list of the top 5 things to pay attention to in 2024 without mentioning this: captives. As you obviously know, I work for ParetoHealth. We're the biggest employee benefits captive in the United States. And the reason I selected captives is not because it's homerism, not because I want to make a commercial for Pareto, it's because I believe in this model. There's a reason why I chose to join Pareto at this point in my career, and setting aside everything that is great about Pareto, and believe me, there's a lot. Captives in general were a very popular subject the last couple of years on my podcast. Everybody wanted to ask about them. Everybody wanted to know more about them. And I really think we're entering into an era where captives will be a household knowledge in the benefits world. They just make so much sense for small to mid-sized employers to diversify their risk, make the long term of being self-funded much more predictable and accessible for smaller employers, and you're able to get cost containment programs that typically are reserved for big employers. Now you have a captive that brings all of those into one place, turns a 50 life group into a 500,000 life group or a 200,000 life group, depending on the size of that captive, and just gives them the scale. The jumbo employers, the Fortune 5s and the Fortune 10 companies of the world, bring that down market and make self-funding really feasible for those small employers. So definitely learn more about captives in 2024. And if you want to know more about Pareto, obviously you know to reach out to me. All right, last but not least, number 5, most important topic in healthcare for you to learn about in 2024, pharmacy and PBM. You will never in your lifetime learn enough about PBMs. Unfortunately, it's a very convoluted structure. There's a lot of players, there's a lot of layers, there's a lot of dollars flowing back and forth. There's a lot of dark money. There's a lot of hidden contracts and things like that that are associated with the pharmacy benefit management world. Spread pricing, rebates, per script commissions, all sorts of crazy stuff that's happening here. And quite frankly, this should be on everybody's radar, and I'm sure it already is. But in 2024, same thing. You probably spent a lot of time this year learning about it. You're going to have to continue to do the same because we're seeing more and more of an employer's plan spend come out of pharmacy. And then when you have things like specialty medications that are really out of control of pricing, you have Ozempic becoming popular. Now everybody wants things like that. You have gene therapies, which technically aren't drugs, but really kind of fall in the world of pharmacy. You need to learn as much as you possibly can about it. And me personally, I'm going to spend a lot more time in 2024 bringing myself up to speed to become an expert in pharmacy, and I think that you should too. All right, there are the top 5 healthcare topics that I think you should learn about in 2024. I'd love to hear your comments, categories that you think I missed or maybe should have used instead. That was just my personal opinion of the top 5 things that I'm going to focus on, and I think that you probably should as well. But quite frankly, there's a lot more than that, and I had to choose some. There are probably some that I should have included instead, but that was my personal top 5. So let me know what you thought.